Welcome back all of you to Government Nursing Officer Exams Mock Test Explanation Series Part 41. First question. Pain in calf on dorsiflexion of the foot. Govt may indicate option 1 thrombophlebitis, option 2 aneurysm, option 3 lymphedema, and option 4 is cellulitis. Right answer is option 1 thrombophlebitis. Command sign is a medical sign where pain is elicited in the calf or behind the knee upon forced dorsiflexion, upward flexion of the foot. The command sign is seen in thrombophlebitis. That is the pain in calf on dorsiflexion of the foot. Next question. Dusky hue of the vestibule and anterior vaginal wall visible at about 8th week of pregnancy is called option 1 Goodell sign, option 2 Hegar's sign, option 3 Chadwick sign, and option 4 is Palmer's sign. The right answer is option 3 Chadwick's sign. Jack is equal to Chad, Good is equal to Hagar, OC is similar to Palmer. So like this you have to remember this. Jack is equal to Chad, Good similar to Hagar, OC similar to Palmer. Jacomer's sign is bluish purplish discoloration of vagina. Chadwick sign is another name of Jacomer's sign. You can see the green color here, which is indicating the same. Jacobs and Chadmer's are same. Then Goodell sign, it is softening of cervix. Hagar sign, softening in consistency of uterus. So these two are softening. Goodell's and Hagar's is softening, but Jacomer's and Chadwick is discoloration, bluish purplish discoloration of vagina. Then another two set is Osiander and Palmer's. Osiander sign you see here, pulsation felt in vagina, and Palmer's sign, uterine contraction felt during bimanual examination. Though that is felt, these signs are felt during inspection or examination. So Chad, that is discoloration. Goodell's Hagar, which is softening. Goodell's is softening of cervix, and Hagar's is softening consistency of uterus, and Osiander and Palmer are similar, which is felt, pulsation felt in vagina is Osiander, and uterine contraction felt during bimanual examination is Palmer's sign. This way you have to categorize and remember the things for easy memorizing in your exams. Next question. A client is suffering from diabetes mellitus. Which of the following symptoms indicate hyperglycemia? Option 1 diaphoresis, dizziness, hunger. Option 2 headache, blurred vision, nausea. Option 3 polyuria, polydipsia, polyphagia, and option 4 polyuria, fluid retention, shortness of breath. Right answer is option 3 polyuria, polydipsia, polyphagia. You can see here hyperglycemia, that P, there is 3 P's highlighted here: polyuria, polydipsia, polyphagia. So just I corrected this spelling. So this is the 3 classical signs or symptoms: polydipsia, polyuria, and polyphagia associated with the hyperglycemia. Next question. A nurse is describing the process of fetal circulation to a client during a prenatal visit. The nurse accurately tells the client that fetal circulation consists of option 1 arteries carrying oxygenated blood to fetus, option 2 veins carrying deoxygenated blood to fetus, option 3 2 umbilical arteries and 1 umbilical vein, and option 4 is 2 umbilical veins and 1 umbilical artery. The right answer is option 3 2 umbilical arteries and 1 vein. 1 umbilical vein. So the fetal circulation consisting of 2 umbilical arteries, 1 umbilical way, 2 a V, 1 V, 2 arterial, 1 way. Next question, which of the following vitamin is soluble in water? Option 1 vitamin A, option 2 vitamin C, option 3 vitamin D, and option 4 vitamin E. Right answer here is option 2 vitamin C. Here vitamin A, D, E, K is fat soluble vitamins and vitamin B and C is water soluble vitamin. Next question. The amount of blood ejected by each ventricular contraction is called option 1 cardiac output, option 2 stroke volume, option 3 tidal volume, and option 4 is expiratory reserve. The right answer here is option 2 stroke volume. Stroke volume is the amount of blood pumped out of the heart's left ventricle with each heartbeat. Each heartbeat is stroke volume. But cardiac output is the volume of blood the heart pumps per minute. So output is per minute and stroke volume is per each heartbeat. That you have to distinguish while you are attempting this kind of questions to avoid negative marks. Next question. Of the following, which is the most common site for metastasis in lung cancer? Option 1 kidney, option 2 pancreas, option 3 liver, and option 4 spleen. The right answer is option 3 liver. The most common site for metastasis in lung cancer are the adrenal gland, bone, brain, liver, and the others. The other lung. So these all are the main areas. See, adrenal gland, bone, brain, liver, and the other lung. Here you can see liver is in this option. Kidney, pancreas, and spleen is not in the list. That is not least affected. So mostly affecting adrenal gland, bone, brain, liver, and the other lung. Next question. The hormone secreted by the posterior pituitary is option 1 luteinizing hormone, option 2 oxytocin, option 3 melanocytes secreting hormone, and option 4 prolactin. The right answer is oxytocin. The hormones secreted by posterior pituitary are oxytocin and vasopressin. Vasopressin is also known as antidiuretic hormone or ADH. Next question. Express 45 in fraction of a day. The first option is 1 by 24, second is 1 by 32, third is 1 by 40, fourth is 1 by 48. Right answer is option 2, 1 by 32. See, a day has 24 hours, so 24 into 60 minutes, that is 1440 minutes. So 45 minutes to fraction of a day means 45 divided by 1440, that is 1 by 32. Next question. Which of the following organ is affected in gastroesophageal reflux disease or GERD? Option 1 duodenum, option 2 lower esophageal sphincter, option 3 diaphragm, and option 4 pylorus. Right answer here is option 2 lower esophageal sphincter. When there is gastroesophageal reflux disease, the lower esophageal sphincter is not working properly, so that the content from the stomach will go back to the esophageal area like this. Next question. Which of the following is one of the most popular and useful ways of showing activities displayed against time, where on the left side it is a list of the activities represented by a bar and along the top is the time scale reflecting the start date, duration, and end of date of the activity. From 1 nomogram, option 2 Gantt chart, option 3 bird analysis, and option 4 rotation plan. Right answer is Gantt chart. Gantt chart is a visual project management tool that displays a project schedule, task, and milestones as horizontal bar on a timeline. Next question. The nurse is teaching a group of patients about the mood stabilizing medication lithium carbonate. Which of the following medication should she instruct the patient to avoid because of the increased risk of lithium toxicity? Option 1, hypoglycemic agents. Option 2, antibiotics. Option 3, diuretics. And option 4 is antacids. The right answer is option 3, diuretics. Lithium toxicity can be exacerbated by diuretics, particularly thiazide diuretics, due to their impact on sodium and water balance in the kidneys. Next question. Which of the following is not a symptom of depression? Option 1, loss of interest in daily activities. Option 2, suicidal ideas. Option 3, delusion of guilt. And option 4 is delusion of grandiosity. The right answer is delusion of grandiosity. See, the other three options, loss of interest in daily activities, suicidal ideas, delusion of guilt, everything is related to depression. But here, grandiose delusions or delusion of grandiosity is common symptom of mania, not in depression. It is mania. It is symptom of manic or hypermanic episodes in a bipolar disorder. Next question. A patient who abuses alcohol and cocaine tells a nurse that he only uses substances because of the stressful marriage and difficult job. Which defense mechanism is this patient using? Option 1, rationalization. Option 2, displacement. Option 3, projection. And option 4, sublimation. The right answer is option 1, rationalization. Rationalization is a defense mechanism where individuals justify their behaviors, feelings, or motivations by creating logical sounding explanations, even if these explanations are not the true reasons. So this is rationalization, finding reason for a particular activity to justify it. Next question. Commonest cause of maternal morbidity in India is option 1, abortion. Option 2, hemorrhage. Option 3, anemia. Option 4, sepsis. This is a tricky question. Here the right answer is option 3, anemia. But sometimes the answer will be mentioned as hemorrhage also. So while we are referring, we will understand that the commonest cause of maternal morbidity, we could say it is anemia, and the commonest cause of maternal mortality, we could say it as hemorrhage. And if anemia is not shown in these options, you can even select hemorrhage. But when anemia is there, the commonest cause of maternal morbidity in India is primarily considered as anemia. Next question. The reliability of a measuring tool has all of the following aspect except option 1, stability. Option 2, efficiency. Option 3, equivalence. Then option 4 is internal consistency. The right answer is option 2, efficiency. Efficiency, while important in practical terms, it is not a core aspect of reliability. Efficiency refers to how quickly or easily a tool can be used or how cost effective it is. Next question. Destruction of alveolar valves is called option 1, empyema. Option 2, bronchiectasis. Option 3, lung abscess. And option 4, emphysema. The right answer here is option 4, emphysema. Destruction of alveolar valves is called emphysema. You can see the diagram here. Normal alveoli and the alveoli with emphysema, which are the alveolus are collapsed or damaged. Next question. When is folic acid started in antenatal period to prevent congenital disorders in an infant? Option 1, before conception. Option 2, during the third trimester. Option 3, during the second trimester. And option 4, during the first trimester. Right answer here is option 1, before conception. Folic acid supplementation is recommended to start at least 1 month before conception and continue through the first trimester of pregnancy to prevent neural tube defects, a type of congenital disorder. Next question. If the IQ of a child is 45, then which category of mental retardation will he belongs? Option 1 mild retardation, option 2 moderate retardation, option 3 severe retardation, and option 4 profound retardation. The right answer here is option 2 moderate retardation. You can see the IQ scoring and the categories. Borderline is 71 to 84, mild 55 to 70, moderate 40 to 55, severe 25 to 40, and profound is below 25. So here it is 40 to 55 rates, that is 45, that is moderate. Next question. Chloroquine exhibits which of the following action? Option 1 antifungal, option 2 anti-amoebic, option 3 anti-malarial, and option 4 antiviral. Right answer here is option 3 anti-malaria. The primary action of chloroquine is against the parasite that causes malaria. So it is anti-malarial action. Next question. The maximum absorption of iron takes place in option 1 stomach, option 2 liver, option 3 small intestine, option 4 tubules. The right answer here is option 3 small intestine. The maximum absorption of iron takes place in the duodenum, which is the first section of the small intestine. Next question. Cracked pot sound elicited while skull percussion indicative of increased intracranial tension is known as option 1 Homan sign, option 2 Bromberg sign, option 3 Perolial sign, and option 4 is McQueen sign. The right answer is McQueen sign. McQueen sign is the sign sealing increased intracranial tension, which will have the kind of cracked pot sound, which is usually associated with hydrocephalus. Next question. Entomology refers to the study of option 1 human behavior, option 2 environment, option 3 reptiles, option 4 is insect. Entomology is related to the study of insects. Entomology, insects. Environment is ecology. Human behavior is like anthropology, psychiatry, all those kind of different scientific branches. Insect, the study deal with insects is entomology. The movement of the head and shoulder is controlled by the option 1 abducens nerve, option 2 accessory nerve, option 3 hypoglossal nerve, option 4 glossopharyngeal nerve. Right answer here is option 2 accessory nerve. The accessory nerve or cranial nerve 11 controls the movement of the head and shoulder. Next question, which is the last question of this series. Vitamin B1 is also known as option 1 niacin, option 2 thiamine, option 3 riboflavin, and option 4 is pyridoxine. The right answer here is option 2 thiamine. You can see the vitamin B complex and the chart here. The race neatly professionally performed by F1 Cross. This is this picture courtesy is going to the Google, but this is very attractive and easily memorable for all the students. That's why I just added here. The race neatly professionally performed by F1 course. So the T thiamine B1 R riboflavin B2 nicotinic acid niacin B3 pantothenic acid it is B5. So the race neatly professionally. So this come then the blue color is performed by F1 course. So pyridoxine is B6, biotin is B7, folic acid is B9, and cobalamin is B12. This is the easy way to memorize the vitamin B complexes. So we are winding up this session now. Thank you all for watching these videos. Please add your valuable feedbacks and like, share and subscribe this channel for more videos. Thank you so much.